everybody, Dr. Sherwin here from Artistic Dental Studio with another episode of Dental Tips of the Week. And I was excited from the beginning of the day because what I'm going to cover today is one of the most frequently asked questions about dental veneers. I'm going to tell you if you're a good candidate for such a treatment. As you know, dental veneers have been quite mainstream, very popular these days. People really like to enhance their smiles because it actually boosts their self-confidence and they feel much better about themselves. They can communicate better, and we all know that the improvement in the smile could transform lives. But what actually is really important is this kind of treatment a treatment that we can consider for every individual? This is what I'm going to cover today. So stick with me. First of all, I'm going to tell you about what dental veneers are. First of all, the veneer actually is a very, very thin kind of facing. It could be made either from a thin layer of ceramic or a thin layer of composite material. The difference between these two types of materials I will tell you about later on. So basically the veneer is something that is glued on the top of the tooth. If I want to talk about different types, let me go to the next slide. Alright, so basically if you just have a look at this diagram, you can see a very thin layer of material is glued on the surface of the tooth to correct the shape or to mask a discoloration. Alright, so if this thin layer is made of ceramic, ceramic is an impervious material. It is durable, it doesn't stain over time, and it's stronger compared to composite. And what is composite? Composite is the normal filling material we use in dentistry today. The normal tooth color filling material. This material is very good in terms of price. So the veneers made of composite are much cheaper than veneers made of ceramic. And another thing is that the veneers made of composite could be done in just one session. With the ceramic, normally we need to take a scan or an impression and send it to the lab. So we need at least 2 sessions to complete the treatment. But with the composite material, easy in just 1 session. More cost effective, but the problem with the composite is that composite veneers normally stain over time and they get dull, they lose their luster. So these are the things that you need to take into account when choosing between these two alternatives. Now, let me go to the next one and see if you're a good candidate for this type of treatment. Ceramic veneer or composite veneer. Okay. Let me begin with this. People normally want to either change the alignment of their teeth, they want their teeth to look more symmetrical, or they want to make some specific changes to the alignment of the teeth to make them look more parallel, or whatever they like. Or the substrate or the teeth are not the proper color. They want to enhance the color, they want to whiten the color. So these are 2 main reasons why we want to receive veneers. In order for the veneers to be successful, veneers should be glued on the top of enamel. Enamel is the harder shell on the tooth. So if for any given reason the enamel layer is worn down or is absent, veneers still could be made, but the connection between the veneer and the tooth will not be as strong, and it's susceptible to leakage and failure over time. So the thing that actually is really important is the enamel, and your dentist could let you know if there is enough enamel on the surface of the tooth for the bonding of the veneer. But there is something here I want to let you know about. We need to tick some boxes as cosmetic dentists when a patient comes to us for a veneer treatment. The first thing is the amount or degree of discoloration. How dark the teeth are, the substrate is. That's very important. Because veneers are made in thin slices. The thickness could vary between 0.2 millimeter to the maximum of 1.5 millimeters on the edge of the teeth. With this thickness and with all the advancements in the dentistry today, we still have some limited ability to cover those extremely darkened areas. So if the discoloration is something very, very severe, the veneer could not be a good option. So that's the thing that your dentist will let you know about. The second thing is the amount of misalignment, the degree of misalignment. That's very important. If it exceeds a certain amount, then you need to go for doing something like orthodontics, Invisalign, getting some braces to align the teeth first of all, and then either go for veneer treatment with more predictability, or in many cases, even the Invisalign or the braces will correct this misalignment completely. And all you need to do is just to go for a session of whitening, improve the shape, and you will not need veneers. So these are these options, and for every individual, these options could vary. So we can benefit from whitening, we can benefit from Invisalign, we can benefit from veneers, and each case differs. So this is a thing that you need to have a chat with your dentist, with your cosmetic dentist actually, and make sure that you are informed about all your options, about all the treatments, about the length of treatments, the cost, and everything. The third thing that actually contraindicates the use of veneers is for people with problems with their jaw joints, and also the muscles. Some people are suffering from muscle tenderness, from clicking in the jaw joint, and these things, if severe, could affect the longevity of the veneers. The other thing is the extreme occlusal forces, extreme forces between the teeth. For some people, the muscles are very, very strong. They may grind, they may clench during the night or even during the day. These are some extreme forces that veneers, because of their very, very thin nature, could easily break. And in these cases, with such great amount of worn down areas, the enamel on many surfaces of the teeth is almost gone. So the connection between the veneer and the tooth will not be that strong. So these are the things that need to be taken into account, and this is why your dentist could tell you if you are a good candidate for the veneer. For example, in this case, patient has come to me with some chipped front teeth. Okay, nice case of the veneer. Or this lady came to me with some striations on her teeth. She was not happy with the lines on her teeth and also the overall shade of the teeth. So this is why we did a session of whitening first, and then some veneers to enhance her smile actually. So every case is quite different, and it should be evaluated before embarking on treatment. Thank you very much for your attention. Please post your comments and questions down below, and stick around. Until next week, we're gonna have a very, very exciting video about root canal treatment. Bear with me. Thank you very much and enjoy the rest of your evening. Bye.